Hey guys, my name's Mark Hall. I was a nuclear medicine technologist for about 23 years, and I recently had to take a medical retirement, and that's one reason that I stammer, kind of like I do. I had something happen. I broke my brain, I guess. But as a nuclear medicine technologist, I often had patients come in that needed a nuclear medicine study done, and their doctor didn't tell them anything at all about what to expect or how the test was done. So I thought I would kind of make some videos that explains it kind of like I used to explain it to the patients when they would come in to me. So with that in mind, this is not medical advice. This is just to kind of let you know what a nuclear medicine study entails, so that if your doctor has ordered you one, um, you'll kind of know what happens. Now, some facilities do it a little bit differently than other facilities, um, but different is not wrong. It comes up with the same results at the end. So like I say, this is just to kind of give you an idea what to expect. Okay, with this in mind, I'm going to go ahead and tell you about nuclear medicine bone scans. A nuclear medicine bone scan in itself is done to look at bone damage. And that bone damage can be from a lot of different things. It can be from physical trauma, fractures, breaks. It can be due to pathological trauma, a sick bone, weak bones. Um, and it can be due to infectious disease infections and things like that. But a routine bone scan, can also be done to evaluate like bone cancer, see how far it spread through the body. Okay, what happens is your doctor orders the study. With a nuclear medicine bone scan, you come into the hospital or the imaging center, whichever place that you're going to have your study done. Excuse me. And you go in early in the morning, and they give you an injection in the vein in your arm. Um, the injection doesn't go in the area that you're having trouble. Like if you're having foot pain, you don't get the injection in your foot. If you're having head pain, you don't get an injection in your head. It goes in the vein in the arm usually. They give you a quick injection. It takes just a minute. It doesn't make you feel any different. It doesn't make you feel funny. And typically, you're allowed to go ahead and eat between when you receive your injection and when you come back to have your pictures taken. Typically, that's about 3 hours later. You can sometimes even get pictures taken at 24 hours after you got the injection. It just all depends. What happens with your bones is you have hydroxyapatite crystals that coat your bones, and these crystals turn into new bone. So any area that you have bone damage, there's more of those crystals in that area than areas of just normal bone maintenance. So if you have a damaged bone, you have more crystals there, and therefore the injection that you get, there's more injection goes to the area of bone damage than just normal maintenance. Now the injection that you get is a radioactive phosphate, and as the radioactivity in it decays down, it releases photons, or little flashes of light on a subatomic level. You can't see the flashes of light, but the nuclear medicine camera can. Okay, so with all that in mind, bone scans are typically done for bone damage. They can be done to evaluate pathological processes. And you get your injection, you come back in, About 3 hours later, you have pictures taken. Typically, you have a whole body bone scan, and they take pictures from the top of your head to the tip of your toes. And specially trained doctors read these bone scans and interpret what you have going on. Areas of bone damage show up as hot spots. And later on, I will get a picture of a whole body bone scan, and I will post it on my blog or somewhere. So actually, I'm going to put a link probably down here across my chest, of my blog site, and on the blog for bone scans I'll have a picture, and you'll kind of see what the pictures look like. There's not one on it now, but I will have one on it shortly. So if you want to look at it, just click on that link below. Okay, what they're going to have you do after you get your injection, and when you come back to get your pictures, they're going to ask that you drink a lot of fluids. And it's important that you do, because the excess injection that's not stuck to your bones within 30 minutes of getting the injection in your arm, the excess injection that's floating around in your skin and muscle and your bloodstream, it has to be removed from the body. So they have you force fluids and urinate as much as possible. And that way when you come back, you get a nice, good, crisp, well, not crisp, bones. Nuclear medicine pictures are fuzzy. So because you're actually imaging physiological function, you're not imaging the cut and dried images like x-rays or CAT scans or MRIs. You're only seeing something that looks like the bone because of its physiological function. So I hope that kind of clears up nuclear medicine bone scans for you, and I'll talk to you later. You have a great day.